right, let's go ahead and get started. For folks on the line, apologies. We had some technical difficulties, mostly on my end, so apologies for that. Thank you so much, Kathryn, for joining me here today. Obviously, we're in the midst of a crisis like no one pretty much in living memory has seen, and we're all adapting to that. We're all figuring out how best to respond to it. And this is part of a series of interviews that we're doing for VPIRG members. As you know, we're trying to give our people the best information they can, and we know that Senator Sanders and his office and folks like yourself have really helped lead the charge in DC to make sure that Americans have the resources they need in times like these. So again, thank you for all you're doing, and thank you for joining me here today.
Yeah, absolutely. Thanks for having me. And, before we begin, I really want to just thank VPIRG for putting these together. I think that one of the things we have realized is how much Vermonters and people all over the country are really looking for helpful information during this unprecedented time. And so we really appreciate VPIRG doing their part to help get information out to Vermonters. It means a lot. Thank you.
Well, thank you. We're all trying to do what we can. So to get started, I wanted to talk a little bit about the federal legislation that's passed so far in response to this crisis. Obviously, a lot has already happened in DC legislatively. There's a lot more to get to that. And I know that Senator Sanders has put out a lot of resources. Many folks listening, and I'm sure we're on the call that he helped spearhead last week. So there's a lot of resources out there on the legislation that's passed so far, how to take advantage of it. But I wanted to ask, are there particular parts of that legislation that you'd like to highlight for folks, or particular resources you'd like to point them to as they're trying to figure out how to navigate all of this?
Sure, thank you. I think I'll start a little bit with some of the wins that we had in the legislation, because I think, there were some really big successes in the legislation that Congress passed a few weeks ago now. So, for folks who are following this, the legislation that passed most recently was actually the third package of legislation to help deal with the coronavirus pandemic. It was the largest federal stimulus in the history of our country, trillions of dollars in aid to Americans, including some really important direct benefits. From Bernie's perspective, it will come as no surprise to anyone on this call that he really put individual people and their families at the forefront of what he was fighting for. So, I think one of our best wins and biggest successes in the legislation was the additional $600 in unemployment benefits that are now rolling out to Vermonters and people all over the country. That unemployment benefit nearly didn't make it. Bernie went to the Senate floor, fought for its inclusion, stopped those senators who were pushing back against it while they were fighting for big corporations. So that additional $600 in benefits is going to make a huge difference to people and their families as we get through this pandemic. In addition to that, Bernie really supported the fight to get direct payments to individuals. We would have wanted to see more, but the fact that every person who makes under $75,000 will get a check from the federal government for $1,200 plus an additional $500 per child is a really big win. We know that money actually should be hitting Vermonters' bank accounts this week. People can check their bank account right now and see if that money has come in. They can go to irs.gov and also find out, you can put in your social security number and find out if your direct deposit was made. If you don't have direct deposit, a check will come in the mail to you. We had actually a really good win this week with that direct payment, because initially there was going to be some paperwork that needed to be filed for anyone who received SSI or disability insurance through Social Security. Those folks who are some of our most vulnerable, we're going to have to fill out a bunch of forms. And fortunately, this week, it was decided that those Vermonters are going to get their checks automatically, which we saw as a really big win. A couple other things I'll just mention really quickly were some efforts to pass the Paycheck Protection Program and expand the Economic Injury Disaster Loan Program. We have so many small businesses throughout Vermont, and we know how much they are working hard to keep their businesses going, pay their employees, and getting those funds to these businesses is making a huge difference. We've already gotten out over $850 million to Vermont businesses alone because of that program. And that program was also expanded. Bernie fought really hard to make sure that small sole proprietors, independent contractors, and gig workers like Uber drivers could benefit from that. So those were some of the biggies, really focused on getting direct support directly into people's pockets during this unprecedented and challenging.
Well, thank you so much for that overview. I just wanted to ask a little bit more. I mean, we'll get more to sort of what the office is hearing and some particular resources, or I know there are frequently asked questions out there. We'll get to more of that in a little bit. But I wanted to ask about how, despite everything that's happened, I mean, as you said, this is the largest stimulus package of any kind that's ever passed Congress at any point in U.S. history. So obviously, there was a lot included in that. I know that there was still room for improvement there. Could you talk a little bit about the Senator's perspective on how that legislation fell short, what should have been included, either in terms of other programs, expansions of the programs that are in there, or any safeguards that he would have liked to see in the legislation that's happened so far?
Sure, absolutely. No, I appreciate that question, because while it was, like you said, the biggest stimulus package in history, we also thought that it didn't go far enough. So, a few of the things where Bernie would have liked to have seen more resources is really to that direct payment piece that I mentioned earlier, the $1,200. That was a great start. It's not enough. We are going to take months to come out of the crisis that we're in right now. We really don't know the date then that will end, but Bernie believes that every American needs $2,000 a month for the continuation of this crisis to really be able to take care of basic necessities. So he is pushing for that. At the center of everything he's talking about, it's all about working families. So we need to increase that fund to $2,000 a month in emergency payments. We also have to guarantee paid medical and sick leave. I mean, these are things that Bernie has been fighting for years. And I think this pandemic has made it all the more clear why we need to guarantee paid family and medical leave for families. Because while we have record unemployment that we're going to need to come back from, we still have folks who could benefit from paid family leave, from paid sick leave. We have people all over this country and all over Vermont who are sick right now, and they need those benefits. We did include some paid leave in the legislation, but our estimates are showing us that it's really only impacting about 12% of workers. And, we need to get that to 100%, no questions asked. We also know, I think some of the folks that maybe don't get enough thanks right now, though I know Vermonters are keeping them front of mind, is all of the frontline workers who have to still go to work. A lot of our healthcare epidemiologist experts said, if everyone could just stay home for 2 weeks, we'd have this beat. But we know that that isn't possible. A bunch of us are home, I'm home, any of us who can are. But we have farmers, we have doctors and nurses and pharmacists and health technicians, truck drivers, transit drivers, our bus drivers all over Vermont, folks who work at grocery stores, in warehouses. They have to keep working, and that's a real hardship. And so one of the things that we really wanted to see in the legislation, and we're going to push for in what we do next, is an additional $500 a week in hazard pay and childcare, and make sure that workers who do have to go to work can be safe. And then, a couple of the other things I'd mention real quickly is a moratorium on evictions, foreclosures, and utility shutoffs. We cannot have people losing their homes, losing their utilities right now. And so, we have to, on a national level, make that a reality. And then the last thing I would mention, because I know how much folks struggle, is stopping all repayment of student loans right now. There was a temporary measure put in place in that legislation that would have temporarily stopped student loan payments. It doesn't cancel them, it just stops them temporarily, and folks have to apply for those. So, Bernie's position for a long time now has been to cancel all student debt. And again, this time it makes it clear that folks can't deal with those debts right now, and we need to at least stop them, but really cancel them all.
Yeah, it has been. It's easy to say as a white collar worker who is able to stay home right now, but it is interesting to see how this crisis really has brought into stark relief the need for things like health care, for paid family and medical leave, ideas that have been considered in both Vermont and DC, and ultimately are not available to many Vermonters and many Americans. So certainly, making this crisis impact Vermonters and Americans as little as possible, given the fact that it is still a pandemic, no matter what any of us do, is priority number one. But I'll say, here at VPIRG, just to editorialize for a moment, we are still working on all of these things. The climate crisis isn't going away. We certainly intend to make clear that just when this pandemic is over, when there's a vaccine, God willing, there's a treatment, that doesn't mean that the need for these things becomes less real. It's just a little bit less in your face. So it's been great to see Senator Sanders and the rest of the delegation fighting for these things over the years, and certainly right now. Indeed. So we'll get to some of the future legislation in a moment. Before we leave the legislative packages that have already passed, I did want to ask, I know, and I'm sure many folks know this, I would imagine some don't, that one of the jobs of a congressional office or a Senate office is actually something called constituent services, where you have folks on staff that their job is to help Vermonters who are having issues, in particular with federal programs. So I'm sure you've been fielding a lot of calls. I've heard from State House Rep on up, people's phones have been ringing up off the hook with Vermonters trying to figure out how to make things work for their family week to week. Are there a couple of kind of key resources that you find your staff often pointing Vermonters to when they call, frequently asked questions, or resources on the Senator's website that you'd suggest people take a look at, figure out how to navigate these new programs?
Yeah, absolutely. No, I think a lot of what we do is all about connecting Vermonters to resources. We have 5 constituent advocates in our office who do an amazing job every day for Vermonters. We have gotten a record number of inquiries and cases into our office in the last month, which is no surprise. We do hope folks will continue to call us if they need our help. So we absolutely are, still answering the phone, still taking cases, and we're happy to help whoever we can. And those folks are working really, really hard. And so we're all pitching in to support Vermonters and what they need. I think in terms of resources, there's a few that come to mind, both state and federal. I think, for unemployment benefits, obviously, Vermont Department of Labor is the first stop. They are, from all accounts, working just as hard as they can with an incredibly outdated system to let them do their job. And so, listen, for my part, I would encourage people to be patient and nice to the good folks at DOL on the phone, but they are working hard. And for folks who visit, I think it's labor.vermont.gov, they can find out how to file for those unemployment benefits, which will get them the additional expanded unemployment check from the federal government. But the state has implemented a new plan for alphabetically applying, but by day, which they're hoping is going to really help with the volume of calls they're getting. One of the things we also hear from a ton of small businesses who are looking to apply for the Paycheck Protection Program, which unfortunately, we found out today that program nationwide has run out of money. We have spent what there was. So, Bernie's going to work really hard to get more money into that program as quickly as possible. Hopefully without needing to wait for a next large package, we can just put more money into that program if all of Congress agrees. But the Small Business Administration, there is a Vermont district office of the SBA. And at sba.gov, you can figure out how to get in touch with our local SBA folks, and they have been tremendously helpful to our small businesses. Another place where we really know people are struggling right now, especially those who have lost their jobs, is healthcare. Again, and we can talk about this more later, but the fact that for most Americans, their healthcare is tied to their jobs. When people start losing their jobs, we know they're also losing their healthcare. So fortunately here in Vermont, the Vermont Health Connect, which manages our public exchange, has set up a special enrollment period. And they have also, you can also enroll for Medicaid if you qualify for that. So Vermonters can either visit the website or call. I have the phone number here and I want to make sure people have it. Give me 1 second in my notes here. I will find it. Is 855-899-9600. So that's 855-899-9600 to talk to Vermont Health Connect, where you can enroll in health insurance, which we know is incredibly important for folks right now who have lost their health insurance because of losing their jobs. So those are just, I think, a few of the resources that we would direct people to. And actually 2 others I want to mention real quick. One is Vermont 211, which you can either visit by going to vermont211.org or calling literally just 211. They have increased their volunteers who are answering their phones. Folks can call 211 for any resource they need help with. One of the places they're great is if you don't have enough food to eat. Vermont 211 can direct you to your local food shelf, help you get set up for Meals on Wheels if you qualify. We know that we need to do more to help folks who are struggling with hunger, and 211 is a great place to start. And lastly, I would just direct people to our website, sanders.senate.gov. Sanders.senate.gov. We have been doing as much as we can to compile all these resources. We send out newsletters more regularly than ever before right now. And you can read all of our newsletters on the website. Right at the top, we have all of our coronavirus resources and newsletters where people can find a lot more information.
Thank you. And for folks who are listening afterwards, when we post this video on our Facebook and other social media channels, we will definitely be putting all of the resources that Kathryn mentioned down below. So if you didn't manage to jot those down, don't worry about rewinding the video. They're right there, and you can go ahead and click on any of them right now. I know that Senator Sanders, the information he's been putting out through the website has been very valuable. I'll also mention that VPIRG did put together a COVID-19 specific portion of our website. A lot of that is really directed towards folks who maybe are doing okay right now, but are figuring out how they can help other people. There are a lot of mutual aid groups that have sprung up around the state and other places, opportunities to volunteer. And we do have some resources as far as, navigating all of these systems. But we really were, trying to figure out how to connect VPIRG members with those kinds of volunteer opportunities. So definitely check that out if you are lucky enough to be able to volunteer right now. I want to shift gears a little bit and talk about legislation that might be coming up, hopefully is coming up. You mentioned healthcare a minute ago. I know, I think it was late last week, Senator Sanders announced that he would be introducing legislation that would significantly expand, I think it was Medicare, for the duration of the pandemic to make sure that people can get the care they need. Can you talk a little bit about that legislation?
Sure, absolutely. Yeah, I think, from Bernie's perspective, he has been the long believer in Medicare for all, decoupling healthcare from employment, making sure that every American has healthcare as a right, not a privilege, not based on your ability to pay, but as a human right to all people. So in this pandemic, again, it's been clear now more than ever that we really need to move forward with the Medicare for all single payer system. So he introduced legislation that would do some important steps to help people during this current crisis. So, before the pandemic even began, we had about 87 million people in this country who either had no insurance or were underinsured. Plenty of folks in Vermont, we know, they have insurance, but a lot of times it's a high deductible plan that makes it so expensive that even though you have that insurance, you really can't afford to use it. And that's unacceptable right now. We also believe that because of the current pandemic, we're going to add another 35 million people to that already 87 million. So it really is time that we really work as a federal government to get healthcare access to more people. So Bernie's legislation, it's going to do a few really important things. First of all, we have Medicare in this country. It's a great system that works really well for the people who can use it. So we want to empower Medicare to really act quickly and decisively in this process to help everyone. So if you're an insured American under Bernie's legislation, even if you have insurance today, Medicare would pick up the cost of all of your out-of-pocket costs. So those are your co-payments, your deductibles, and anything else that you pay today when you go receive healthcare. So that's prescription drugs, everything, whether you already have private insurance or not. For uninsured Americans, people who don't have any health insurance coverage right now, Medicare under Bernie's legislation would fully cover the cost of all of your medically necessary healthcare needs. And we do that all pretty simply. You go to the doctor when you need care, and that might be a telehealth appointment right now. It may be some important tests or other things that really can't be delayed. And the provider is going to use your information to bill Medicare for your out-of-pocket costs if you have insurance, but for the full cost of your care if you don't. And the patient, you aren't going to be charged anything. We also, Senator Sanders also included in that bill a few other really important provisions that we wanted to make sure folks could get some support from. So one of those was to say that providers can't bill patients after they've billed Medicare. It's known as balanced billing in the health policy wonk world, and no surprise billing. So people can't be billed for things that they didn't anticipate. We also, in that legislation, limit the price paid for prescription drugs. Now is not the time for our drug companies to be making money hand over fist. So under his legislation, we limit the price that Medicare pays for prescription drugs to be equal to what the Department of Veterans Affairs pays, which is a negotiated, much fairer price for prescription drugs. And we also say that private insurance companies can't decrease their coverage over time. And, another thing that I'm really proud of in the legislation is that we waive the late enrollment penalty for Medicare. We know some folks who have reached their Medicare eligibility age. They didn't enroll in Medicare because they had a job or other health insurance. And if you enroll in Medicare late, you're forced to pay a penalty. And so under Bernie's legislation, that penalty would be waived because we don't want anyone to delay care or coverage because of penalties and out-of-pocket costs. So that's kind of the crux of what that legislation does, and we're really going to keep pushing for that and make it a reality.
Well, best of luck on that. That is it's hard to overstate how important the work you're doing on that is. I know I have a family member who right now is uninsured, not a member of my immediate family, but my extended family, and they're struggling to figure out if they can access the healthcare that's out there through the exchange, if they can make the money work, or if they're gonna just take a gamble that God willing they don't get sick with coronavirus, and they ride out the next couple of months between now and when they're going to be hopefully off unemployment, and that's the kind of decision we never want Americans or Vermonters having to make. And certainly right now, that is not good for my family member, not good for any Vermonter or American, and not good even for the people who do have insurance. So it really, again, it feels like this crisis has brought into stark relief how we really are all in this together. And even if you're purely self-interested, you don't want to have other people not having full access to our healthcare system. So definitely was glad to see that and hear a little bit more about it. I know you've worked on healthcare with Senator Sanders for quite a while. So I did want to, shifting off of healthcare specifically, though there might be some healthcare related things in this other legislation as well, talk about the sort of quote unquote, we're up to the fourth stimulus now, I guess, and the negotiations that are going on in DC. I know, mostly just from reading the New York Times and Washington Post and the other media that's out there, like everyone else, that's very much in flux. That it's a little bit unclear what might land in that legislation ultimately, and that there are conversations going on about what's going to need to happen even after that additional piece of legislation. So what can you share with folks about what it looks like might be in the offing for the next few weeks, and then what work might remain undone after that most immediate next step?
Sure. I think that's a great question, because it's very clear that, while the CARES Act, which we passed last month, did some really important work, it was not enough, and we're going to have more work to do. So I know that Congress is ready to do that work. Most of Congress is really prepared and ready to keep fighting to bring more resources to people. I think right now it's very much in flux. We don't know if what we're going to see next is sort of a smaller interim package that maybe deals with some things like the expiration of the Paycheck Protection Program funding and some other funding sources that are really starting to deplete quickly. Or if we're going to have a larger package next that looks at, the infrastructure needs, how we really restart the economy in a robust way. It may be that we have two more things down the road. So we're really focused on kind of what those look like. In the immediate term, I think from Bernie's perspective, a lot of it is about those things that I mentioned earlier that didn't get included in the previous package. Some of the things like the moratorium on evictions, increasing the amount of funding that we're making sure that the American people have every single month. Some of those healthcare fixes that I just mentioned. One of the things, especially when Congress writes legislation quickly, sometimes things are left out on purpose, and sometimes they're left out by accident. One of the things that I think we really need to address moving forward is that $600 in additional unemployment benefits. It was made sure that was not counted for purposes of Medicaid and other federal programs. But unfortunately, it still is counted if you are on the exchange, so Vermont Health Connect in Vermont, and you get a subsidy. Unfortunately, right now, we do count that money. And so things like that hopefully we can fix. Again, the student loan issue, we really need to make sure that folks, Vermonters with student loans, get the support they need so that they can spend the little money they do have on those really basic needs and not worry right now about paying back for those student loans. And then, the other thing that while we've talked a lot about healthcare, we haven't talked as much about our healthcare providers. There was significant funding included in the last package to help our healthcare providers with some emergency funding, both one pot of money for our community health centers and then some additional fund that would help all healthcare providers. But we're going to need to do more. Our healthcare system in Vermont is pretty much all rural. Pretty much every one of our hospitals has some sort of rural designation, and those hospitals are really struggling, and they're struggling at a time when we need them probably more than ever. We need to make sure that our nursing workforce is strong, that the people who are on the front lines of healthcare have the protection that they need to care for patients, and we really need to make sure that they all have what they need and that they can keep their doors open, because if our small hospitals start closing their doors, those are beds we may need now and in the future. Bernie's also one of the biggest supporters in Washington of our federally qualified health centers, the community health centers in Vermont. Vermont probably does better than any other state. Nearly 1 in 3 Vermonters gets their health care from a community health center. I'm one of them. And making sure that they have funding that they need to keep caring for patients is incredibly important. And then the last thing I mentioned that we really need to work on in this next package is what's called the Defense Procurement Act, which is the ability of the federal government to come in and direct our businesses in the United States to produce. The Defense Production Act, to be producing the personal protective equipment, the ventilators, the things that we really need to care for people in this country right now. What the president has done is not nearly enough. And so Congress really needs to act to bring the full force of that law into practice so that we can really produce the things in this country that we need.
Yeah, it's been unfortunate to see the absence of, let's just say politely, the absence of executive leadership in DC. I think I'll leave it there. So it sounds like a lot of the, more how do we jumpstart the economy conversations are, well, maybe starting to happen, but probably not going to be kind of central to the next package. But just simply because there are so many immediate needs, I know that it's critical that we address the public health crisis. I really appreciate you getting folks up to speed on the steps that hopefully we will be taking as a nation in the next few weeks on that. And I will definitely be interested to see in the future, maybe we can have you back and I don't want to speculate on the timing of it, but at some point to talk more about what that more economic crisis response package might look like. I guess the last thing I want to ask is just sort of broadly speaking, do you have any other thoughts? Does it feel like there are any pieces of this conversation that we missed, or resources that you would really want to make sure that our listeners are aware of?
I mean, I think we really covered a lot, and I hope that the information that we discussed was helpful to people. I think from our perspective, we want to help get information out to as many Vermonters as possible. Bernie hosted a telephone town hall last week. He invited Governor Scott, Senator Leahy, and Congressman Welch. I think we're going to keep doing those. The delegation and the state have all been working really closely together to get information to Vermonters. We're going to keep that up. You can always call our office, visit our website. We're happy to provide as much information as possible. And, I would just say from Bernie's perspective, I think one of the things to really sort of keep in mind is that, as we get through this, we really are truly all in this together. And I think, as Bernie put it recently in an op-ed he wrote in The Guardian, we all have to act with love, compassion, and urgency. And I think there's no better way to put it than that.
I could not agree more. Let me just, before I bid you good afternoon, say if folks are not on Senator Sanders' email list, I certainly would suggest getting on that. As Kathryn mentioned, there are a lot of really good resources they've been putting out there, and I know that's going to continue. VPIRG is also doing regular interviews with folks in a wide range of fields to provide critical information. We obviously are going to be letting our members and supporters know about that through our email list as well. So please do sign up for that at vpirg.org if you're not. Kathryn, I can't thank you enough. I know you're swamped in DC right now, so we really appreciate you taking the time to speak with us today. And Godspeed down there. Good luck with all of the work that you're doing.
Thanks very much. I appreciate you having me.
Absolutely.
All right, be well. Take care.
You too.